Hi, we're back again, and we have a very interesting guest now, and a very important guest because he is a master of something we're all trying to figure out if we're a senior citizen. So I'm going to introduce you to Paris Cluff, and he says his insurance, but I'm going to tell you there's an art to that too. Hi, Paris.
Hi, how are you? Good to be on the show, Carole. Thanks for having me.
Yes, it's wonderful. And where did you get the name Paris? That's wonderful.
Oh, cool. My parents actually enjoyed the story I don't know if you're familiar with Homer's Iliad and the Odyssey. And, Prince Paris abducted Helen of Troy and started the Trojan War. And so
Yes.
my parents enjoyed that story, and they thought Paris was a neat name. And so I've named after Prince Paris. That's how I got that name.
That's wonderful. That's fantastic.
My
And-
parents never let me date anybody named Helen, though, so I don't
Oh,
know.
I was just going to ask you about that. Did you ever find Helen?
No, I didn't. I didn't.
Oh, okay. This is wonderful. I'm so excited to have you here today because it says insurance, but there's an art to that too, because it's an art of talking to people and helping them to understand what you're trying to sell or give them or whatever. It's that understanding that you get, and to me that's an art.
Yeah.
Not everybody can do it. Like I call in to some of these Medicare things, and I really don't know what they're talking about, And I come out of the phone and say, well, what does it mean?
Yeah,
So,
you're more confused after you call sometimes.
That's right. So you have that art of being able to help understand. Actually, it's all of this stuff, but you make it understandable, and you make it so that you can say, "Well, I'm doing something for myself by doing this," and that's important. All of us have to remember that we have to take care of ourselves too.
Absolutely.
Yes. So tell us something about, like, if I was calling you and I have a Medicare card with A and B, one or two, whatever it is. How would you speak to them?
So if you have a Medicare card, which is the red, white, and blue card that you get, Part A, it comes to you because you pay taxes. Had a job perhaps, and you worked the requisite number of quarters to be able to qualify for Part A. And then Part B, as in boy, is for, Part A is for hospitals, anything you might do for surgeries or emergency rooms, and then other services that are there's a lot that goes into it, but
Yeah.
for the time we have here today, Part B is for anything you'll do outside of a hospital, like at a doctor's office, things that you'll do at a lab service, maybe in x-rays, clinics, things like that. So
yeah.
Part B gives you the ability to do that. If you don't have any other insurance besides Medicare, and you go to the hospital or have a surgery, you'll have a deductible, and it's just about $1,400 for 60 days. And every 60 days that renews, so if you don't have other coverage, that can add up if you're in the hospital a couple times in a year. And then with Part B, the doctors and outside of the hospital, that's a 20% co-insurance. So if you go to the doctor with nothing but Medicare, you're going to pay 20% of whatever the bill is for the x-ray, for the labs, for the doctor visits.
Yeah.
So it can add up and be expensive if you don't have any other coverage available.
Yes, it does. So it does. Does Medicare take care of more things than that now?
So when people have just Medicare, I really try to help them understand that they need to have either a supplement or a Medicare Advantage plan. And right now we're in open enrollment for Medicare Advantage plans, which is actually Part C. So a lot of people know about Part A and Part B because that's right on their card.
Right.
And then they hear a lot about Part D, which is for drugs or prescriptions. But then everybody asks, well, what happened to Part C? Did we just skip that one? And so Part C is Medicare Advantage plans. So Part C and D right now have an open enrollment between now and December 7th. It's every year from October 15th to December 7th. And so since we're headed towards December 7th pretty fast. And so if somebody has Medicare, what I'd first do is I'd sit down with them and I'd make sure that who their doctor was, and then I'd also make sure what their prescriptions are, the prescriptions that they're taking, because that's really important for seniors to have those prescriptions covered under the plan.
Oh, yes. Well, I didn't even think of that at all.
Yeah.
So that's so important. And what confused me was I've had the A and B, but I don't know how it's ever helped me. If they've paid anything for me, I just don't know.
Well, if you've, we were talking earlier, and you said that you have the VA because you're a veteran. Thank
Yeah,
you very
the
much for
VA.
your service, by the way. And so somebody with the VA benefits may not ever really understand or use the Medicare card because everything that's done under the VA is a different department than the Medicare department. So if you go to the VA and you have those benefits there, they never will ask you for a Medicare card. Medicare will give you the ability to go see doctors outside the VA and utilize doctors there. I have a lot of clients that are VA, that they're veterans, and they will use the Medicare card to get second opinions. They will use the Medicare card to go to another doctor outside of the VA that they might want to see and that they're interested in seeing. There's different levels of benefits that the VA offers, and for example, a couple of my clients they qualify for the VA benefits. However, in their particular lineup of benefits, they didn't have an ambulance that was covered. And so Medicare Advantage plans will come in and cover the ambulance costs so they can have an ambulance. And the ambulance will take them wherever they want to go. But it's nice to have a plan that will cover those things that VA may or may not cover. And because Medicare Advantage plans are zero premium, they don't cost anything to actually just have the plan, it's very attractive for those people who are veterans who want to have that benefit as well.
Wow, that's really interesting. I was so glad to hear that because I always said, "What the heck are these for?" And not. It's interesting to know that there are benefits for me that I could have. I've never used, but I could certainly use it if I needed it. Right?
Absolutely.
So that's wonderful. And what was the other question I had? What does your age have any difference on the benefits or?
That's a really good question. So Medicare supplements have a cost. They're a monthly premium to have a supplement, and the supplement's cost is based on your age. So if you're right at 65, usually they have a really good deal because you're turning 65, you just got Medicare, and they want to offer you a really nice entry-level premium. And then as you age, unfortunately, those bonuses go away, and 70, 80, upwards, the premiums do start getting pretty expensive, or they start to increase. Medicare Advantage plans have a zero premium, so they don't have anything that you have to pay a month. Well, there are a couple in Fresno County and the Central Valley that do have a premium, but most of them have a zero premium in the Central Valley. Now, you have to be 65 or older, qualify for Part A and B in order to have a Part C plan or Medicare Advantage plan. You have to, if you aren't 65 or older, though, some people have Medicare because they're on disability.
Oh.
And if you have a disability for 24 months or more, you can usually qualify for Medicare. And the clients that I have that are in that category usually have worked with a lawyer or worked with disability to be able to obtain that benefit, and they get the Medicare card. In fact, I had some kind of bittersweet news just this last week. One of my clients got better, and her disability is now gone, and she doesn't qualify for Medicare anymore. So I unfortunately lost a client, but to a good thing. So I'm glad that she's better. I'm glad that her disability has now been rehabilitated and she's doing better. So that was neat to hear.
Oh, that's wonderful. I'm glad to hear that. Also, I think that I'm somehow connected to Aetna. Do you know anything about that?
Yeah, Aetna is one of the carriers that provides a Medicare Advantage plan and a Medicare supplement, and they have a prescription drug plan. So what happens is Medicare will partner with a private insurance carrier like Aetna or like United Healthcare or Humana or Brand New Day. There's lots of them in Fresno County, and they will partner with them to provide the service. And so Part C plans, Medicare Advantage plans, are actually administered by a private insurance company, but Medicare pays them to do that. And so that's why they can offer a zero premium on a lot of these plans. And there's also prescription drug plans that follow the same thing, which is a Part D. So Part D is where you get your prescriptions, and Aetna and other carriers like Aetna have a prescription drug plan that they will administer for Medicare for you. And so that's a premium, and then you have co-pays as you pick up your drugs each month. So that's there's some cost to having a Part D prescription drug plan.
Well, the VA used to charge me for all my meds. I'd get bills every month, and of quite big ones.
Mm-hmm.
Because I got to take a lot of medication. But now, for some reason, they stopped sending me bills, so I'm getting that as a benefit now that
That's
I
nice.
don't have to pay for my medicines.
Yeah, the VA, if you qualify for VA benefits, they're really worth it to have the VA benefits. And I have a lot of clients that have VA benefits and do Medicare Advantage plans as well, so they can have both of those benefits in case they want to have a second opinion or something. So
Yeah, that's wonderful. It really is. I am the type of person that is busy all the time. I keep myself busy, art and writing and doing stuff like that. And I don't really spend much time taking care of myself.
mm-hmm.
And that's something I'm trying to learn, that I got to think about being a little kinder to me.
You're right. Your health is your number one asset. If you lose your health, it doesn't matter how much wealth or other things you have, because your health is just so
know.
important.
I know, but I am so blessed that my health is good, really. I'm feeling fine. I have a little, I don't have a ladylike walk anymore. It's a boo-boo. But still around. I'm still doing things, and I'm still happy, so I'm happy.
That's great. That's great.
Yes, I want to say, if I can, to a lot of older people that you either can get old or you can get back alive. Because if you sit down and decide, okay, I'm old, I'm just going to sit here and die, and a lot of older people do that,
Yeah.
and it just weakens you, and you do get sick, and you do die early. So get yourself interested in something. Get a hobby. Get something that gets your mind working. And if you can't, if your body is hurting, you don't have to do that. But at least keep your mind active.
That's true.
That's right. So that's my advice to you.
That's great. There's a lot of the Medicare Advantage plans have extra benefits, like a gym membership. And there's several companies are now adding things like social gathering. I know we can't do a lot of social gathering right now with COVID and everything, but some of the companies are offering extra benefits for seniors to get together and kind of have some friendships and do some classes on art and other things that they do. Actually, I have one of my clients got together with her insurance, and they found out the medical group was having an art class, and she learned how to paint. And one of the years, she painted this beautiful, a lot of them actually. I watched her get better and better every year as I'd meet with her and sit down with her. And last year, or maybe the year before, she gave me one of her paintings, and it was really beautiful.
Wow.
And it was so nice to be able to have her share with me that she had really enjoyed this plan and the insurance that I put her on, and that all the extra benefits were really working for her. And it was neat to have a really neat painting now that I actually have in my office. So it's neat to have that.
That's wonderful. Well, you deserved it, because you've certainly done a lot to help other people, and that you're blessed because of that. Maybe you don't know how blessed you are.
Thank you.
For giving your love and work and everything to help other people. I just admire you so much.
Thank you.
And I'm so glad you came in today. And please come in again, because even though it's just the season right now for Medicare, people still should understand what they've got in their hands, So
Absolutely.
come in again. We'd love to have you.
Absolutely. Thanks so much for having me, Carole.
Okay,
Appreciate it.
thank you so much. And that's it for today. So I'll see you next Thursday, and you have a nice day.
If you're on Medicare and Medicaid in the state of California, you may be able to get more benefits at no additional cost. A United Healthcare Dual Complete Plan combines your Medicare and Medi-Cal coverage to give you more benefits than original Medicare. If you have Medicare and Medi-Cal, call Paris Cluff, an independent insurance agent, at 559-825-1678. That's 559-825-1678. This plan is available to anyone who has both medical assistance from the state and Medicare.